So you can now privately interact with your doctor through a digital service aimed at fighting HIV. South African digital health startup Aviro Health launched the digital service as the world observes World AIDS Day. Now, over 50,000 people have used the service ever since its launch last year. And let's discuss it further with the Chief Executive, Musaed, who joins me now from Cape Town. A very, very exciting initiative that has been launched there. And I just want to get a sense from the time it was launched, how has it been received?
Good evening, Rofhiwa. Since the time that it was launched, we've had different models. With the Aviro Pocket Clinic, we're supporting patients with HIV self-tests, either when they were taking it home via WhatsApp or at a booth outside a facility. And the response has been really excellent. With really good feedback from our users. We've got about 90% of our users in the booth-based testing say that it's credible, that the information is credible, that they would refer other people to it, and that it was easy to navigate. And that was quite heartening to us.
So this is quite an innovation and pioneering one, in fact, and I'm just wondering about why it's so important to launch something of this nature at this time, and really where you see it growing in terms of spreading far and wide and giving that kind of access to many patients across perhaps even the African continent.
Yeah. So we actually started on working on Pocket Clinic before COVID. But I think that actually COVID just heightened the awareness that, you know, the normal testing and starting of antiretrovirals was decreased. And so actually what we see is that that this is the right time for this kind of innovation. So when we thought about it, it was about increasing access to patients, that couldn't gain normal access to their healthcare facilities. How could they, using technology, gain the access of those services like counseling in the comfort of their own homes or outside in a booth-based facility? And I think that move towards taking services out of the facility so that the demands are not as heavy on the facility and taking it more to the patient, that move towards self-care is an important one, and we'll be seeing more of that in future. We are in South Africa and in Kenya, and we are going to look to expand but we're taking it step by step to see, you know, if it's successful, if this model is successful in different contexts and with different diseases as well.
And tell us how exactly it works for those of us who are intrigued by this initiative and perhaps would like to try it out. How exactly does it work? And is it a free-to-use service, or are there some costs that are associated?
Yeah. So at the moment, the service is available through our partners. At public facilities, for instance, in our pilot in KZN, what happens is you go to the facility. You don't go inside the facility. Outside the facility, there's a booth. You interact with the tablet. You're given an HIV self-test kit. You go through the counseling on the tablet in 4 different languages. We support English, Zulu, isiXhosa, and Sotho. You go through it. You report your result, and then you are linked to care. In another model, for instance, in Kenya, you get an HIV self-test kit, you go onto WhatsApp, and you go through that same patient journey on WhatsApp, you report your results, and if you're positive, we link you to care. So at the moment, I would say it's free, but it's free within our partners that we are supporting at different clinics.
And how has this had an impact on self-care for HIV-positive patients? We've mentioned earlier on in the bulletin that we've seen a lot of people not taking care of themselves, not taking their antiretrovirals. Does the fact that they've got this online platform now increase the opportunity for people to take better care of themselves as they deal with the HIV?
Yeah. At the moment, what we're focusing is on the onboarding journey of testing. So that means basically the part of the health journey where you become aware that you need a test, the HIV self-test itself, and the confirming of results, and then the linkage to care. We haven't looked at the journey from starting ARVs and further, but the platform itself is built for multiple diseases and to follow on the journey of what we call adherence.
What about those who may not have access to things like data? How does this platform reach far and wide to make sure that people do get that access that they would need?
So on the client-facing side, there are 3 different channels. If you don't have a phone, you can access it at a facility on a tablet version. And if you do have a phone, especially a smartphone, you can go and go to the free website. So there's what we call a progressive web app that is online. It's reverse billed, so you don't pay for that. However, if you go onto the WhatsApp line, you will be using some of your data, but we try to keep a lot of the content as small as possible so that you don't use a lot of your data.
Right. Now, you did mention in an earlier answer very briefly that the growth opportunities are endless here. You are operating in South Africa and Kenya as well, and you are looking at how you can make it work for other diseases. Just talk me through those growth opportunities a little bit more in depth, and the timelines that you are giving yourselves as Aviro.
So at the moment, as you said, we've assisted 50,000 patients. We've largely focused on HIV, but we also developed a diabetes chatbot in association with Stellenbosch University, in which patients were receiving diabetes education and advice. So that is, for instance, one disease vertical we will look at, for instance, supporting diabetes. That is, so the growth is in disease verticals, but the growth is also in geography. So we're looking at South Africa, Kenya, and beyond. And lastly, I would say we are also looking at the private sector to support some of the private sector, and we've been having discussions around that.
And I'm sure you'll be very successful in those discussions, given how innovative this particular project is. That is Aviro Health CEO Musaed Abrahams joining us there to speak about an exciting new platform that helps those who are dealing with HIV and AIDS deal with it a little bit better and, of course, learn more about self-care.